I'm Dr. Rajib, hematologist, hematoncologist, and bone marrow transplant physician. The month of September is considered as the Blood Cancer Awareness Month. So I take this opportunity to explain what blood cancer is and what we need to know about blood cancers. Now, the subject of medicine which deals with blood-related disorder is called hematology. And the blood is produced from bone marrow. So any malignancy which involves marrow is part of blood cancers. And there are other component of hematological system also, that is called lymph nodes. So the malignancy involving lymph nodes called lymphoma, these are also part of blood cancers. So mainly there are two types of blood cancers, leukemia and lymphoma. Now, blood cancer is a very aggressive disorder. Aggressive means if we don't treat, then most of the patient dies. But the positive part is, if we treat properly, then most of the blood cancers are curable. Now we say that the cancer is curable if treated properly. Now, this is partly true because all cancers are not treatable. But remember that majority of blood cancers are curable if treated properly. So, if a patient is having blood cancer, then how we can suspect the patient is having blood cancer? There can be anemia and symptoms of anemia like weakness, lethargy, dizziness. And anemia is very common, but most common cause of anemia is iron deficiency anemia. But in addition to anemia, there are other symptoms of blood cancers also. One of them is bleeding manifestations. The patient may have bleeding from skin, bleeding from gum, increased bleeding from menstrual bleeding, bleeding from any other sites, as well as there can be symptoms of infections like fever, cough, these things. So if a patient is having any combination of these symptom like anemia, bleeding manifestations, fever, then we should suspect of blood cancer. Now then we need to diagnose. The blood cancer there can be some hint from the peripheral blood or blood picture, but to confirm blood cancer we need to do bone marrow examination. And once it is confirmed by bone marrow examination, then we need to go to a hematologist or hematoncologist for proper management. Because blood cancer can be treated by chemotherapy and in some cases, in addition, radiotherapy also. But it must be treated by a trained hematologist and hematoncologist. If it is treated by a trained hematologist and hematoncologist, most of the blood cancers can be completely cured, mainly by chemotherapy. And there is another mode of therapy, very advanced mode of therapy, by which most of the blood cancers, be it leukemia, be it lymphoma, can be cured, that is bone marrow transplant. By bone marrow transplant, what we do is we destroy the diseased bone marrow and replace it with new healthy bone marrow from a donor. And within few weeks, the patients produce normal blood cells and get cured of blood cancer. So we need to be very conscious about it, whether if a patient is having these features, whether they are having any blood cancers or not. And if the blood cancer is suspected, then the patient needs to be treated under a trained hematologist and hematoncologist, because most of the blood cancers are curable. So get out of your fear and misconception that blood cancer causes death of most of the patients. It is not. Blood cancer is curable. So if you have any features of blood cancer, any sign of blood cancer, so get it treated and be cured. Thank you.